Princess Sarah Zeid of Jordan visited Moroto district in Karamoja sub-region to advocate for better newborn and maternal health. Together with officials from the UN's World Food Programme, Zeid visited Nadunyet Health Center 3, where integrated health systems have been applied to help lactating and expectant mothers fight malnutrition. At this center, food is only distributed to mothers who undergo a mandatory medical checkup at the health facility.
That's why we provide nutrition services here as well, to incentivize, to provide a greater incentive for those mothers to take up those services which are so important to their health and the health of their children.
According to the district health officer Magdalene Kumol, the food center motivates many mothers who would not be easily identified in the communities in which they live to seek antenatal and prenatal care.
It has helped to increase the turn-up of the mothers to come for health services at the community. Like the pregnant mothers, they come in numbers. The mothers, the children, they bring for immunization.
At Loptuk Parish, it's the same arrangement, with more emphasis on fighting stunted growth. Proper nutrition is key for children in their first 1,000 days. Here, the children receive nutritious foods to cure acute malnutrition.
I am deeply troubled and distressed by the situation that I have seen today of girls and women. Met a woman in the Integrated Health Center who had 9 children, 5 of whom had died, and she had not eaten yet today and was there with her 9th child to seek services.
The Jordanian princess was surprised to hear that the men in Karamoja leave the duty of feeding their families to women, which has in part contributed to malnutrition and stunted growth of the children.
If they go home without food for their husbands, then they get beaten, and a lot of issues.
At this center, the World Foods Programme Scope Coder technology monitors the progress of mothers and their children. An electronic card is issued to the women who use it for every health checkup and issuance of food. School children are some of the most affected by poor nutrition.
You know, from home there's not enough food at home there. People are starving now, they are sleeping. Even some people sleep more than 2 days without eating.
We eat when we are at school, but from home we don't eat. Because we have no food from homes.
The number of girls that are dropping out to go back and work in the household and falls if there is not food provided in the schools.
The integrated health system has also been used in refugee settlements. At Mvepi settlement in Arua district, many refugee children have been immunized against several diseases as their mothers come to collect the food relief. The number of refugees who access treatment through this system have risen. Malaria, pneumonia and diarrhea are some of the highest disease burdens that contribute to malnutrition to many children in this settlement. The challenge, however, is the ignorance of many mothers on how to prevent such diseases. Ali Mivule, NTV, Arua.